All right, so we're going to take off with part 3 of discussing coronavirus and the information available to us all. Just takes time to find it. That is my goal with all these videos, is ultimately to give you information so that you can be well informed and educated for yourself. Take the information, digest it, chew on it, figure it out for yourself, and decide what you and your family need to do to protect you and your loved ones, all right? I'm not giving you recommendations. I can't do that, right? So again, my name is Dr. Dale Brown. I'm the Wild Doc. I ultimately bring this information so that, again, you can be empowered with information, ultimately be able to discover the truth for yourself. So I highly recommend you guys get these articles. You can TWD in the comments right now on Facebook. My staff is still working because this has been an ongoing process. I've been reading hours upon hours, losing sleep, all kinds of stuff. But the reality is I wanted to get this information out to you. You know, it scares me right now that our U.S. government is wanting to fast track the development and safety trials of the coronavirus vaccine that they want to bring to market really quickly here. All right, I went through that in the prior ones in more detail. I'll touch on that again. Here's why. I'm going to go through the last couple slides, the last couple bits of information from this research study here. They have been studying for more than 10 years, they have been studying a coronavirus vaccine. There is a major problem with the coronavirus vaccine, similar to the problems they saw with the original RSV, respiratory syncytial virus vaccination in infants. They saw with that prior vaccine, the RSV vaccine, when they vaccinated infants, they saw it in animal trials as well before they brought it into human trials and they used it on infants. That's wrong. The trials in animals even showed when the animals were exposed to RSV, it would increase the likelihood of them having a respiratory tissue destruction and damage type response, ultimately increasing the mortality rate. And that's what they saw in children. Luckily for our babies, they took that RSV vaccine off the market. They are trying to develop another RSV vaccine, and I'll have to go through that later. But the coronavirus vaccine, we're seeing similar problems in animal trials where they vaccinate these animals and then they challenge them. That would be actually an effectiveness trial, but they don't use that type of effectiveness to say a vaccine works. The way in which they say a vaccine works is they give you the vaccine and they watch your immune system. Did it respond? Did it produce antibodies against the virus that they injected you with? And if it did, they say it's effective. The problem is you may be sensitized and you may generate antibodies and immune response to the virus and the vaccine that they give you. It's how your body's going to respond in the future when it comes in contact with the natural virus, the virus in nature that you will ultimately come in contact with. That's where the problem comes in. So the direct harm from the initial direct harm within a short period of time being vaccinated isn't always there. Sometimes the harm comes later on in life when you're naturally exposed to that virus, and that's what this details out. So to pick up a couple of those bits of information, here it is. The infection would have been transient below the limit of detection 2 days after challenge, or neutralized in the lungs of the homogeneous before testing for the virus. Nevertheless, the type 2 immunopathology pattern, the lung tissue damage, the immune pathology, the immune system upregulation that caused the harm. The pattern was seen only in animals given the inactivated vaccine earlier. So the pattern of immune pathology, tissue destruction, was seen only in those animals. This is an eosinophil. Eosinophils, I described that before, but they're basically like using hand grenades. They cause a lot of collateral damage when they are activated, and they shouldn't be activated upon natural infection and then natural re-exposure. They shouldn't be activated in our lung tissue. The problem with the vaccine is it causes upregulation and distortion in our immune response, an unnatural immune priming that ultimately leads to an increased tissue damage in the lungs, thus increased risk of pneumonia and lung pathology because they were vaccinated prior to natural exposure, all right? So that is where the harm comes in. Some quick takeaways from this right here. Infection would have been transient, but the limited detection, below limited detection 2 days after challenge. So when they say a vaccine is effective because somebody comes in with pneumonia and tissue destruction and harm, and I'll show you a study here in a moment where they showed it in pigs. This sensitizes our immune system to use a hyper-inflammatory, hyper-oxidative stress, tissue damage type response. So it's like using hand grenades. You want to get rid of bad guys, you know what? Hand grenades will do it pretty darn quick, but you're going to have a lot of collateral damage and you might harm somebody else that you wouldn't want to, such as your own tissue in your body. That's the analogy I'm using here. But it quickly removes the virus from the lungs. So when they test, they'll go in and say with like the influenza vaccine, they'll go in and say, we tested the person, they came in with pneumonia and severe lung pathology, and they ultimately died. We tested them within 2 or 3 days of being infected when they came in the hospital, and we didn't see any influenza virus in their body, so therefore they're vaccinated, they got immune pathology in their lungs, and they died, but the flu could have been what triggered the immune response that was primed because of the initial vaccination. They were exposed, they mounted an immune response, their immune system decided to use eosinophils and inflammation, excessive inflammation, hand grenades, and because of that collateral damage, it removed the influenza virus, but guess what? It also killed the person because they caused a distortion in the natural, normal, healthy immune response that we're designed to have when we come in contact with these viruses naturally, all right? So I want you guys to think about this. The best thing we could do is not say, how can we distort and avoid? Why don't we work on trying to enhance our natural immune system function in regulation, that balancing act that is necessary for healthy immune responses? So going on here, that was just an added tidbit there. This combined experience provides concern for trials with the SARS coronavirus. And again, the virus going around that they've genotyped right now is supposedly more of a bat-like coronavirus, all right, and it is causing severe acute respiratory syndrome, which is a SARS coronavirus. It's a novel coronavirus. It's a new one, novel new one, okay? You could say that. Clinical trials, and I did show you that they did use, in the University of North Carolina, engineered a bat coronavirus to be capable of infecting human tissue cells, human lung tissue cells. I'm not saying that University of North Carolina released that virus. I'm not saying any of that. What I'm saying is it's quite ironic that they literally had major criticism for creating a coronavirus that was in bats, which this one is now being genotyped to being likely coming from bats. I think there's a lot of irony there. Take it for what it is, learn for yourself, decide for yourself, all right? Or conspiracy theorize for yourself, whatever. Or realistic. I mean, that's what I am. I'm a realist. So there's risks here. Clinical trials with SARS coronavirus vaccines have been conducted and reported to induce antibody response and to be safe. So SARS vaccines, coronavirus vaccines, have been reported to be safe. All right? However, the evidence for safety is for short periods of observation. The concern arising from the present report is for an immunopathological reaction occurring among vaccinated individuals on exposure to infectious SARS virus. The basis for developing a vaccine for SARS. Additionally, safety concerns relate to effectiveness and safety against antigenic variants of SARS coronavirus and for safety of vaccinated persons exposed to coronaviruses, particularly those of type 2 group. There's major concerns because their safety trials don't watch or don't challenge human beings against it. But in animal studies, I've shown you multiple over this series of videos about coronavirus. Multiple research studies have shown that the coronavirus vaccines induce protection, but upon exposure, your immune system mounts an attack against you and it causes harm to you and possibly death, okay? So they were wanting to fast track this coronavirus vaccine. And our Dr. Fauci, head of like NIH or something, infectious diseases, says it will take about 3 months to get the trial going, 3 months to get safety and immunogenicity data. And all that means, they're not studying whether people actually live better or survive more once they're exposed to the coronavirus vaccine or coronavirus, if they're vaccinated. They're not studying that. All they're studying in these trials that they're planning on doing, all they're going to look at, 3 months of safety, they're not going to challenge these people with a natural coronavirus. that they vaccinated them against, they're going to vaccinate them and then let them go. As long as they don't die immediately upon vaccination or cause massive serious issues immediately upon within the first less than 3 months, it's safe. But if it primes your immune system to cause a hypersensitivity reaction, basically like a massive allergic reaction, later on, when you're naturally exposed, the people vaccinated may die at a higher frequency than the unvaccinated. That is a major problem. So I'm praying and hoping that someone will pick this up within the scientific community, medical community, who has strong morals and ethics and say this is not okay. With the available evidence upon animal trials, we cannot go to fast-tracking this coronavirus vaccine for the rest of the population. Because of well-documented, here we go again with the quotes from the study, because of well-documented severity of respiratory disease among infants with RSV vaccine and subsequently infected with RSV that is considered to be attributable to Th2 type immunopathological reaction and a large number of studies in bulb C mice, mouse model that have described and elucidated many components of the immunopathological reaction to RSV vaccine is similar to the coronavirus vaccines and mice, supports caution for clinical trials with coronavirus vaccines in humans. Caution is critical here, folks. All right, rabbit hole if you guys want to go, I'm not going to talk about it long, but it's ironic to me that now that I'm seeing the evidence of eosinophilic activation and disruptions caused by vaccination, I said to myself, I wonder what's going on with eosinophilic diseases in our children in the U.S. and different places like Denmark, okay? They're saying increases in eosinophilic esophagitis is increasing in children in our populations, and it's beyond what better diagnosis can explain. We are seeing increases in disease conditions, and some of which can be very, very harmful. Eosinophilic attack to your liver, eosinophilic responses in your skin, dermatitis, massive skin responses, and eruptions, gross stuff. Going into that later. During the last 2 decades, the incidence of eosinophilic diseases or conditions, eosinophilic esophagitis, eosinophil harm or damage in the esophagus of children has increased significantly over the last 2 decades, ironically in relationship or association with increasing vaccination campaigns. Increase in pneumonia. This is the one I was talking about. This is a study, again, TWD in the comments on Facebook. You get an opportunity to read these studies for yourself. Vaccinated, not vaccinated. Again, vaccinated against the flu, challenged with the flu, they vaccinated the pig against, and more tissue damage was seen in the lungs of the pig that got vaccinated versus the pig that was naturally infected. Folks, right there you have it. But yet this pig, here's the irony. If what is true about the mouse models, the monkey models, these studies in RSV vaccines and in studies of coronavirus vaccines, this pig would clear the virus faster. It would remove the virus because they're using hand grenades. More tissue destruction, damage, okay? More damage because they're using hand grenades, but it clears the virus rapidly. So when they go in the hospital, if this was a human being, they go in the hospital, they test them for flu, and it wasn't the flu, they died of pneumonia. That's why we're seeing massive increases in deaths from pneumonia, in my opinion there. My opinion, okay? But that could explain it very, very easily. This could also explain why the CDC-funded studies that I've spoke about before, I've got videos on my website, thewilddoc.com, all right, has shown that individuals who were vaccinated, especially 2 consecutive seasons, that when they became infected with the flu virus that they were supposed to be protected from by the vaccine they got that very year, they had more shedding. They were spreading more of the virus, 6.3 times more shedding if the individual who was infected with the flu was vaccinated that year against the flu and vaccinated the year prior against the flu. Because why? If this is taking place in human beings, that easily explains it. Because if the tissue damage is causing so much destruction and buildup of scar tissue and inflammation, then your immune system can't even attack it. So your lungs are getting worse and worse because of vaccinations. All right, so what about treatments for coronavirus? Let's get into that. Critics slam treatment for SARS coronavirus, again, ineffective and perhaps dangerous. Great article to read there. How do you like that? Even in the journal Nature, they use these skull, you know, the Grim Reaper, you know, malaria, AIDS, SARS, all those things. So World Health Organization, British Medical Journal, here we go. This is a response. It's not an article or study, but it's discussing a study that then I was able to track down another study about traditional Chinese medicine use in coronavirus treatment. So World Health Organization response, great read. Please go and check it out. Here's the study of human beings being treated when in the hospital with SARS, with a coronavirus infection, using traditional medicine drug treatment, but also adding to it, all right, the traditional medical treatments may be harmful. That's why I pointed out this article. Go down that rabbit hole yourself, all right? Now this article here, traditional Chinese medicine, herbal medicine, used, sadly they didn't describe the specific herbs that they used in this study, but they did the study with traditional Chinese medicine, which uses typically multiple herbs, many herbs, and they can change it according to the human being's responses. So it takes a practitioner there. But they randomly assigned them, placebo-controlled trial, to get these Chinese medicine herbs, and guess what? They saw no differences in tissue damage, but those at the extent, but these are radiographs, these are x-rays that aren't very specific to the extent of tissue damage, all right? But that was radiographs, x-rays. But they go on there at the bottom to say it took fewer days to show the improvement in resolution of the infection in those given Chinese medicine herbal treatments. All right, what are some of these herbal treatments that is out there in the literature and research that we may be able to turn to if we feel like we need to? You know what? I'm not freaking out about it. Now, one thing that I have that many people don't, I have a luxury of being a doctor that carries and prescribes and uses herbal medicines, herbs that God created. I'm lucky enough to have the information that God gave us and understand that I believe His medicines are much better. That's why Ezekiel 47:12 said, let fruit be for food and leaves be for medicine, folks. Now, fruit can be medicine as well. Sambucus nigra, that is black elderberry. Elderberry was shown to be antiviral against the coronavirus in studies in chickens to make sure the coronavirus wasn't causing weak eggs. But there you go. You have a trial, you have a study in animals at least, and direct antiviral properties of elderberry against coronavirus, flu viruses, many other viruses. It's a great antiviral. But what's really cool also is it increases our capability of responding after we kill the virus, responding to that inflammation, which is needed to kill the virus. Elderberry helps us generate an anti-inflammatory cleanup crew to help resolve the tissue damage and help our body heal afterwards. So really cool stuff there. All right, that's why I'm going to shamelessly plug elderberry from Wellness Way with, guess what? Linacera japonica. That is Japanese honeysuckle. You know why I put Japanese honeysuckle in this elixir, in this tincture with elderberry? Elderberry, phenomenal for the flu. Japanese honeysuckle, though, it's said to be, within the viral world, it is said to be like echinacea is to the bacterial world. If you want a potent antiviral, which again, I will show you that Chinese government officials have literally said within the medical herbal community, said honeysuckle is what we need to go to treat coronavirus. And this was with SARS coronavirus in the past. But again, I would say with the number of studies that show the wide span and catch-all of honeysuckle being able to inhibit and protect people from sepsis, animal sepsis studies, Japanese honeysuckle was able to rescue death from sepsis, prevent death from sepsis. So there's a lot of benefits to honeysuckle, and the literature is out there. Again, okay, we got Japanese honeysuckle. Recently, Japanese honeysuckle also been employed and extensively to prevent and treat some serious viral diseases of human and veterinarian conditions, such as SARS coronavirus, H1N1 flu, is being called the Bouvardier. I don't know what that means. Anyways. At the same time, the main composition of Japanese honeysuckle was used widely in traditional Chinese medicine prescriptions, which are published by state administration of traditional Chinese medicine in China to prevent and control SARS coronavirus virus infections. So in 2003, you have it, government, traditional Chinese medicine, herbal elixirs were using Japanese honeysuckle to treat SARS coronaviruses in the past. Now again, I'm not saying that this elixir has been tested against the current coronaviruses, but the ingredients has been tested against coronaviruses that would be similar to the one, and because when you see herbs be able to take care of H1N1 flu, H5N1 flu, H3N2 flu, all these different viral strains, you know what? I'm betting this is what I'm going to if the evidence shows that coronavirus is circulating in my area, which it is, different strains though, all right? As the above said, Japanese honeysuckle was used to implant in China and Asia, East Asia. In 2003, Japanese honeysuckle was used as the most popular traditional Chinese medicine to treat coronaviruses in China. But again, Argentina, Australia, Brazil, Mexico, New Zealand, and much of the United States, Japanese honeysuckle was thought as a major nuisance and restricted in parts of North America and New Zealand. Now, by nuisance, it means it's an invasive species. I have Japanese honeysuckle growing everywhere on my farm, everywhere. Like it is. It's like it takes over. It's very viney. It can kill other plants. So that's why they call it a nuisance. They don't call it a nuisance because of its medicinal properties. Pharma probably causes it a nuisance because of its medicinal properties. They're probably like, Japanese honeysuckle is a real nuisance because if they didn't have Japanese honeysuckle, we'd be getting a lot of more Chinese people to buy our honey or our pharmaceutical drugs that ultimately actually were shown to cause more deaths with SARS. Anyways, going on, small molecules targeting acute, another journal, Japanese honeysuckle for that one, antiviral effects of, this one is actually, I can't even pronounce the scientific name, glycyrrhiza, all right? Glycyrrhiza, whatever. All right, this is licorice, okay? Licorice. All right, identification of natural compounds with antiviral activities against SARS-associated coronavirus. This one, the results suggest that 4 herbal extracts, and there's 4 different herbal extracts in here. I can't remember the ones in there, but I've got you multiple studies. Get online, TWD, get these studies, read through them. If you got these herbs grown in your backyard, harvest them and make your own medicine and prep for the coronavirus epidemic. And I'm not freaking out, people. Don't freak out about this. It's more for money driving into the hands of people. That's the way I see it. All right? And I know somebody's going to say it now. They're like, well, you're trying to drive money into your own hands. Listen, if I brought you beneficial information, guess what? I would love if me and my family could benefit from that and pay our mortgage with it. I'm going to be honest. In addition, inhibition of severe acute respiratory syndrome coronavirus replication in SARS mice models with stinging nettle. So here it is, actually challenging these and giving stinging nettle to these mice. It has been shown that natural plants contain antiviral activities to other coronaviruses. And the mechanism of action of these herbal products is mainly through inhibition of viral replication. Stinging nettle. Wellness Way has got stinging nettle. Wellness Way has got your licorice. Wellness Way has got your honeysuckle and your elderberry and reishi in there as well, which massively enhances our balancing act that our immune system has. It's a major immunomodulator. All right, another study here on alkaloids, Stephania tetranda. There you go. Get that stuff if you want. Another one, Polygonum species. Multiple different herbs here again antiviral against the coronavirus. And I want to point out something. Let me see if I get one of these. Whoop. So multiple of these studies will say it also inhibited in the infectivity of S protein, retrovirus, Vero E6 cells. These findings suggest that emodin may be, okay, these plant extract compounds may be considered a potential lead to therapeutic agents in the treatment of SARS. So they literally, in multiple of these studies, what do they say? They don't say, hey, maybe we should tell people about these herbs and their antiviral properties or their immune balancing and immuno-enhancing, modulating effects, their beneficial effects to their immune system, and antiviral properties against corona. Let's not tell them about the herbs. Let's try and develop a drug. We can't develop a drug. Let's let a bunch of people die. Meanwhile, God already provided the medicine. That's my opinion. God provided it. We're just bottling it for you. That's what I say. These are God's medicines. That's what I love about what I get to do. I get to glorify God every single day and say, you know what? He created a medicine for anything we will ever face. That's what I believe. Folks, I hope you've been blessed by this information. I hope you benefit from it. If you go through I know that Ashley's probably done it. 5231 is my doctor's code. If you want to you have to use a doctor's code, set up an account through the Wellness Way store, and get these herbs if you so wish. Again, I'm not saying you have to go out, and if you get it and you're like, well, we never got a Corona, now I got a stinging nettle bottle sitting on my shelf. You know what? It's used for balancing with, it can help with testosterone levels in men. It can help with allergies and eczema and different things like that. You know, licorice. Now, one thing I'll say about licorice is don't take a ton of it, especially if you have high stress and high cortisol levels. It does support the adrenals, but you could also, it slows the breakdown of cortisol, so you don't want to take this in the evenings because it could prevent you from having a quality night's sleep. So take it in the mornings if you're going to take licorice. All right, and elderberry, you can take it throughout the day. Active infections with cold viruses, with flus, all these things, studies, both human trials and animal trials with these herbs the herbs used in it, not this one specifically. Again, FDA, you know, legalities, I got to say, this elixir has never been clinically studied or FDA approved for the treatment of anything, any virus, ever. But there are human trials on it that show it's effective. But it's never been FDA approved for that. So I have to make sure that you guys understand that legality there. Again.
The herbs, can you go through one more time? Someone said, what's the last one? And I said, what are you referring to? She said the Stephanie herb?
So Stephania tetrandra. Okay, I don't have a common name for that one. So I pulled a bunch of different studies off there. I think I've seen stuff on red and green algae. I think Green Med Info out there had some great information on that too. You know, so there's a lot of great information and sources out there on some of these herbs. But these are the herbs that I've used for different medicinal purposes for me and my family, my patients. This is the one I literally formulated myself. So again, if you want to grab elderberry for many different reasons, for health promotion, you know what? Supporting me and my family is much, much appreciated for the time and effort that I put into this. So again, use the doctor code 5231. So 5231. Again, love you all, appreciate you all. I've got to go take care of some other things today. What is the shelf life for the elderberry? This is honestly, 5 years. It's a really, really long shelf life because it's an alcohol extraction. Herbs solidified in alcohol. There's only a few herbs that lose their potency. Echinacea may eventually lose its potency, but elderberry, honeysuckle, mushrooms especially, have a very, very long shelf life in alcohol extracted tinctures or elixirs. So these are extremely long. So multiple years in essence. So to have those medicinal properties. So when you have lower concentrations of alcohol, a lower alcohol proof, we use one of the highest alcohol proofs that are used in the bottling of these extracts. One, it extracts more medicine, the higher proof alcohol. Not always necessary for a quality medicine, but you do get a little bit more. Once you get up to 50 or 50%, I think, or whatever the proofs are, 80 proof, 90 proof, 100 proof, you get really, really quality medicine, and then you just get a little bit more percentage when you get higher concentrations. Like Everclear would be the best alcohol to extract, though it's not a massive beneficial effects when you get from 100 proof to 200 proof. But it also improves its stability when it's a higher proof alcohol, because then you don't have that denaturing and basically rotting of that plant material and plant compounds within your elixir. So really, really stable, really, really good. Yep. I appreciate y'all. Love y'all. Share the truth. Don't just like it. It's the only way we're going to save lives.